Tom. Tony doesn't have the mics on here. Good afternoon and welcome to the Public Services Committee meeting. The meeting will start in 1 minute. We don't take roll call on anything. You can just say approval of the minutes. We don't do roll, we just say all approve, yes, no. Yeah. I know, me too.
Good afternoon and welcome to the Public Services Committee. Today is Tuesday, March 13th. Call this meeting to order. Ask for approval of the minutes from our last meeting on October 10th, 2017.
Move approval.
Is there a second?
Second, Staley.
All those in favor say aye.
Aye.
Motion carries. Thank you. It's been a few months since we've met last. Today we are going to be talking, we've got two related items today. We're going to be talking about drug prevention treatment enforcement, as well as followed by the Sioux Falls Police 2017 crime statistics. So first of all, we will go ahead and get started. Today we have Marty Jackley, Attorney General, here to present, as well as Chief Burns, to present. So I invite you forward, and for the record, please state your name and take it away.
Thank you, Madam Chair. Marty Jackley, South Dakota Attorney General, and I appreciate your invitation to come here today to talk about what we as a state are seeing across our state when it comes to drugs, what we're doing about it, and really my opportunity to ask you to join with us in a partnership. I say that because as you look at what law enforcement does with the Attorney General, the state's attorney, the sheriff, and the chief, we always approach this as a partnership. There are things that are happening that I think we can work well together on the prevention side. I will tell you that I will be making an announcement tomorrow on some of the opioid issues that I think may lead themselves to some opportunities to work together also. When I work with the legislature, I always find the importance of when you talk about prevention, though, is really understanding the problem. And I'm going to take just a moment today to talk a little bit about opioids and meth. But probably one of the best videos that I've ever seen is the ones that two Augie students did. And what makes it so powerful is it really combines the making of meth to really what it does to your life. And this was the video that won the contest. We used drug control funds to ultimately give educational grants to students. They competed, and they put this together. And it's located on nomethEver.com. That's law enforcement's prevention project for meth. But with that, I'd just like to play it real quick so you can see. It's about 80 to 90 seconds of really buzz. there's other videos that are on nomethever.com. You see some of them on the news channels. Private industry has partnered well with law enforcement in this project and have donated a lot of different services. This year, when I testified before the legislature, it became apparent that we in law enforcement throw out a lot of terms like 8 balls, and at one point, members of the legislature came to me and said, Marty, would you just explain to us what really is happening in our state? And this chart really came out of that conversation. And it starts with, where does meth come from? Before 2012, I would have told you meth oftentimes was manufactured in the area. We passed a bill on the pseudoephedrine reporting that really stopped that, and we have less than a dozen manufacturing cases a year. So the meth that you see in Sioux Falls, the meth that your law enforcement officer is dealing with, is typically coming from the southern border. When you talk about, well, what is 5 grams of meth? 5 grams is what a nickel weighs. 5 grams of meth will poison 30 to 40 people. So it doesn't take very much of that meth, and it becomes a big deal. Obviously, we're talking about Sioux Falls, but this is a map of the state where we show where all the arrests are, where all the meth that's confiscated is located. And so when you look at Minnehaha County, it's 1,472 arrests, and it's about 5,000 grams. And so it's about a third of the methamphetamine in our state, which is fairly consistent with the population size. When you look at, when I say the consistent, when I released the 2017 crime statistics, which is really coming from our chiefs and our sheriffs, you look at violent crime, generally speaking, murder was down, kidnapping was down, child pornography was down, sex abuse cases were below the 10-year average. But the one area that's kicking us is drugs, and it's really methamphetamine and opioids. We saw statewide a 7.2% increase, and that's what you experienced in really Sioux Falls in Minnehaha County. The other area that I talked about are prescription drugs, and this is just a snapshot of what we're facing as a state. And it really took me back as Attorney General. Did you realize in 2017 there were about 596,000 legal prescriptions in South Dakota? Let me say that again. Last year there were 596,000 legal prescriptions of 39.3 million doses or pills. And that doesn't include the fentanyl busts and all the other illegal drugs that are coming into our state through the black market. And this chart lists what the top 10 are. Obviously, hydrocodone is the big culprit, so to speak, that we see the most of, with 234,000 prescriptions in the state of South Dakota. So what are some of the prevention opportunities? What are we doing about it? I talked a little bit about No Meth Ever. I would encourage you to go to nomethever.com, learn more, see part of the purpose of nomethever.com is to go allow you to click on a county or a city and find out where the treatment is at, find out law enforcement contact information and other things. Another project that we have going on is Project Stand Up. This was, again, really the education community, the healthcare community, and law enforcement banding together and putting out a program. We're passing out some of the brochures tonight. It's as simple as this. It's an anonymous texting, and you just type the word drugs to 82257. And it has been huge across the state. This is just a map showing you really what it has done in the first 6 months. And I think the important part is, look, if you look at Sioux Falls alone, you'll see that about 18% of the different anonymous tips have come directly to Sioux Falls. And when you look at what essentially the tips are, again, it's a heavy focus on methamphetamine and some level marijuana. It's a program that's working. It works in conjunction with other great programs like Crime Stoppers, and it's a good thing. And it's something that as you look for opportunities to work with the state, I would hope that you'd look at Project Stand Up to join with law enforcement, or Project No Meth Ever. Again, you look at what's going on across our state. I mean, methamphetamine does affect violent crime. It causes those numbers to tick up. I mean, it's fair to say that meth and opioids are affecting every community, every family, every one of us. I mean, one way to say it is, it affects one of your family members. If it doesn't affect a family member, certainly a loved one, when you leave here today and drive away, it will likely affect you because somebody is out there on the streets impaired driving. When you write your next health insurance check, it affects those rates because of all those ER visits and the healthcare problems, and it affects the workforce. And the way to get at it is prevention, treatment, and reasonable enforcement. And when it comes to reasonable enforcement, I mean, that's the men and women in uniform. I just want to encourage you that as you get requests from your chief, he's a good chief, I hope you listen to him. When he needs more resources and more officers, that's important. Obviously, I play a role on that with DCI along with the prosecutors that we have, and we do put forth a considerable amount of resources here in the area also because it's important. With that, I certainly would, at an appropriate time, answer any questions that you have. Again, thank you for letting me have this opportunity.
Thank you so much. I appreciate the presentation. I will turn it over to the committee for questions, and then I know we have several other city councilors here, and I'd offer them for questions as well as, and then potentially the public as well. Councilor Staley.
Well, Mr. Jackley, I had the privilege of hearing you speak at the Downtown Rotary a few months ago, and you gave a presentation about, and I'm going to be mixing campaign information and possibly, we know you're running for governor, but you were talking about your three-pronged approach to handling the drug issue, and I think I've got this right. You were talking about prevention, treatment, and enforcement. Am I getting those in the right order? Okay. So, and then when you talked about the prevention part of the treatment part, you were asked about a statewide treatment facility, which, and I did share it on Facebook, you know, your points, and a lot of people, and it's just Facebook, but people seemed to be compassionate and saying, you know, we don't necessarily want to be throwing a lot more people in jail for this. There was questions about how are we going to treat that thing. We want to prevent it, of course, but we want to help people to be helped. So my question to you, since you're here, you're putting yourself out here, is what is your plan for a statewide treatment program, and how is that going to look, and how is it going to be funded? Because I think that's going to help Sioux Falls too, as far as, do we have it here? Do we have it in Pierre? Or do we have it in satellite areas? Or do you have a plan for that?
I think generally speaking, the conversation needs to go to two different facilities, one in eastern South Dakota and one in western South Dakota. I think that those facilities or those opportunities need to be a partnership between private industry. They need to be a partnership involving the city, and involving the county, and involving the state. And of course, I as Attorney General don't appropriate funds, but I listen to the legislature. And I listened and watched the bills where the Attorney General gained support of doing something about opioid manufacturers. And I can't talk too much right now. Stay tuned to tomorrow morning at 9:45. At the City Administration Building, where I'll be making further announcements. But I would suggest that there's a national investigation going on that involved at some point almost every state attorney general. I joined it in June. There have been about a dozen state attorney generals that have broke from that to bring separate lawsuits. I would suggest that in the event a opioid manufacturer misrepresented the risks and the benefits of opioids to chronic pain, they have a level of responsibility when it comes to that. Aside from that, you know, that's a legislative question, but I will continue to be a strong voice that, just like I said at Rotary and just like I said tonight, this is about prevention, treatment, and reasonable enforcement. And when it comes to treatment, it takes private and public to me means city, county, and state.
So are you saying that the opioid manufacturers may be held responsible for paying for the treatment facility? Am I hearing that right?
I would generally state that. If you look at, for example, I'll provide you an example with the tobacco litigation. Back in 1992, attorney generals brought tobacco litigation against the major tobacco companies for misrepresentation about risks and other things. The state of South Dakota has brought in about $440 million from that litigation. That litigation funds a lot of what I would call the education endowment, and those dollars go to school kids. That type of a scenario that you tie any recoveries from litigation to what is perhaps caused or involved. And so I would suggest that in the event that there's a determination of responsibility by a drug manufacturer for addiction related to opioids, that those dollars would appropriately go to treatment and the state's responsibility of partnering with cities and counties. But again, this is significant enough that I think our state needs to look at two facilities, one east and one west. And I think your chief and your sheriff on talking about the triage center and those opportunities are on the right track, and I support them in those conversations.
So are you talking about a Rapid City and a Sioux Falls location?
I'm talking about an East River and a West River, whether it's in Sioux Falls, a regional type setup. I mean, to some degree, that's for local government to decide those issues. But certainly, when you look at some of the health and human services issues with Yankton, there are a lot of challenges with law enforcement when you're at the other end of the state and you have to travel with prisoner transports and other things. I'm suggesting that it would make sense to explore two areas of the state, that this is a significant enough problem when you have the meth issues that we have as a state. I mean, it's a national meth epidemic. You have the president declaring it essentially a national opioid epidemic, and you have your prescription drug monitoring program just showed in South Dakota alone 596,000 prescriptions, and that's not the black market. I think it's significant enough for two particular areas of discussion.
Right, and I'm just thinking in terms of funding, if you're talking about city and county, if it's in Yankton, then that city is going to have to pay for it, right? Or would you say that, so if you talk about a municipality, then Sioux Falls wouldn't be paying for it?
I'm suggesting, when I say regional, that I'm suggesting that you look at if cities want to participate in it, which I think they should. I think we need to look at a regional type facility in eastern South Dakota and western South Dakota, that if somebody in some local government wants to benefit from that, they have to have skin in the game.
Councilor Sailberg.
Thank you. Thank you, Mr. Attorney General, for being with us today. I would maybe, in relation to Councilor Staley's question, she's asking about the centers. I mean, in most subjects, if you can cut the problem off before it starts or have some sort of prevention, especially with this subject, because statistics prove once you start, basically you're hooked. What do you focus on when you talk about prevention? Are there particular areas that you talk about or aim at, or where do you go from there?
On the prevention end, I believe that the best way to do it is to get into the schools. And that's why you see the effort in Project Stand Up, going into the schools, working with school administrators. And it's not just Project Stand Up. There are a lot of different, it's Freshman Impact and a lot of different good programs. It's frankly DARE and Empower and those type of programs. And so I think it's so important that we begin the conversation as parents in our schools, and we have to give them the resources for that. Some of it can come from Project Stand Up. Other areas are important. I mean, private businesses have done an excellent job in this area. I mean, it's been the Sioux Falls area that has essentially given us Project Stand Up statewide, with what Sanford did on that donation, what some of the media companies have done in producing the ads, what the college kids have done. I mean, that ad that you saw at the very beginning, those were Augie college kids. And that's a pretty powerful ad, I hope you would agree. And so I would suggest we just need continued efforts on those type of prevention projects, and we probably need to be in the middle schools and high schools.
Mm-hmm. Yeah, earlier the better, I'm sure. Did you say the statistics that I think you claimed that crime was down while meth use is up? Did you say that part? Because you would kind of think that a correlation would go, as we've talked, with the increased use of drugs, that's increasing with the crime, but
you hear a lot of different statistics, and what I would encourage you to do is, first of all, when you see statistics, if there's a disclaimer that don't rely upon these because they're not accurate or they're not complete or they don't give the full picture, I mean, that speaks for itself. I, as Attorney General, work with the chiefs and the sheriffs to every year issue a crime statistics report. It's the true numbers. It's the numbers that are our officers are seeing and are doing. That's been issued statewide. It doesn't necessarily, and it breaks down some of the county and the city and the other numbers, but the charts that I put out with the press release are a statewide focus. And generally speaking, the serious violent crimes such as murder, kidnapping, child porn are down. The sex offenses are at a 10-year, below a 10-year average, and drug crimes were significantly up. They were up 7.2% statewide. And generally speaking, there's a level of consistency with what Sioux Falls has been seeing on that.
Okay. Well, thank you again for your time and being here today. Appreciate it.
Okay. Any other questions from the committee? Go ahead, Councilor Starr.
Thank you, Mr. Attorney General. It's great that you could share with us today. It's been enlightening as part of this. I guess I'm left with the reasonable enforcement part of your three-part proposal. I think one of the things that I've heard you say publicly is that maybe doubling the enforcement, or not doubling the enforcement, doubling the penalty for meth use. And I've seen around the state, in fact, it did definitely reach our family with my daughter's birth family on the reservations. They're actually, as part of dealing and using meth, that being banned for life from their families, and I wonder sometimes if that's you try to turn your life around and you come to that conclusion that you're in a bad spot, and then you lose your family as well. So I think that'll be interesting to track that over time to see how that works for our Native American friends. But how do we double the penalties for using meth without doubling the facilities? Our county is going to make a large investment in a new jail and locking more people up, but I don't hear the part about we're going to provide the treatment as we lock more people up. Or if we double the penalties, I don't think as a state our citizens have had the appetite to build more prisons. In fact, we've kind of seen the opposite from the legislature, where they've said we need to release more people. We need to, we seem to have labeled drug offenders as nonviolent and release them sooner rather than keeping them in prison longer. Do you see a major switch in what the legislature is willing to do and what our citizens are willing to do?
Great question. You mentioned the word users, and it's always clear to talk about manufacturers, dealers, or users, or we call it the possession cases. If you look at what the Attorney General's Senate Bill 63, which was the meth package, that the governor supported, that a bipartisan Republican and Democrat legislature supported, that the chiefs and the sheriffs and the state's attorneys supported, dealt with the manufacturers and dealers. And so it did not specifically address what I would say the users. And it did a couple of things, and I'll talk about those. But the reason I brought that bill is because just like the Senate bill that I brought to get rid of manufacturing, you took away the ingredients, and now we don't manufacture it here because you can't get the pseudoephedrine. So what 63 does is it empowers our men and women in law enforcement to take away the dealers. If the dealers can't deal drugs, then we are not going to have that much of a supply here, and we will actually lessen the burden on our jails and our penitentiary. The other important aspect of Senate Bill 63, arguably there, on Senate Bill 70, there was a shifting that affected some of the state responsibility over to the local responsibility, which is primarily the county and the sheriffs. This attempts to work at swinging that pendulum back a ways, because it talks about mandatory penitentiary sentences, not jail sentences. Jail is the Minnehaha County Jail, penitentiary is the state prison. So what Senate Bill 63 did two things. Number one, it said if you're going to deal or manufacture meth in the state of South Dakota, we have an enhanced penalty. We're going to go from 0 to 10. Right now it's 0 to 10 years. It will give the judge discretion 0 to 15. The second thing it did is it said, all right, if you're a drug dealer and you get caught, you're going to actually serve a mandatory penitentiary sentence. Those were already on the books, they just weren't being enforced consistently. Now understand, a 1-year penitentiary sentence really is about 85 days. And you say, well, geez, Jackley, your math isn't very good for an electrical engineer. But it's what the law does, because typically you only serve 30% of your sentence, and there's some other good time involved, and so we're really talking about 85 days. But you will serve a 1-year mandatory sentence unless 6 simple things apply. One is you can't be violent. We don't want violent felons running around. Number 2, nobody could have died in the drug deal. And number 3, the big thing, you have to truthfully tell law enforcement about your drug dealing so that your chief and your sheriff can work up the chain and stop the drug dealing. That's all it really simply did. So the hope is you will find less individuals addicted in your jails, less individuals in your emergency rooms, and less individuals in the state penitentiary. When the legislature did the finance side of it, and I disagreed with it, but I have to accept it, over 10 years, they decided that this whole package would only cost $1.5 million. Over 10 years, an entire decade. And my position is it will save a heck of a lot more when it comes to family structure, when it comes to your health insurance, when it comes to your workforce, and when it comes to the county jail. And so I think this is a cost savings bill. Only time will tell, but with the manufacture of meth bill that we did, time has told and it works. And so, but I agree with you, just simply throwing away the key and locking somebody up for an addiction doesn't make sense. But make no mistake about it, a user of meth is dangerous. That's a violent crime, and it needs to be addressed. We addressed it on the state level by giving the men and women in law enforcement the tools that they needed and that they asked for to get out the dealers.
Thank you.
Yep.
Sorry, thank you. Are there any other city councilors here that had questions? I know this is unique, it's our committee meeting, but there are additional city councilors here, and if you do, I would invite you to come up if you had questions. If not, I'll make just a brief statement. One, thank you for being here. I think what you're hearing is that the city cares, obviously, something you already knew, but this city council is engaged in this conversation. The triage concept that we've been meeting and talking about with the city, the county, and private entities in Sioux Falls and in the region has been taking all this information and trying to figure out what works best. And I hope that you will be a part of that your staff will be a part of that as we move through the process of trying to figure out what we're going to do with this epidemic of meth. So thank you for your time today. We'll move to the next presentation today. Thank you so much for being here. Thank you. The next presentation we have is the 2017 crime statistics. Thank you, Chief, for being here. Appreciate it.
You bet. Chief Matt Burns, Sioux Falls Police Department. Madam Chair, again, thank you for the invitation to come speak to you today, talk about our 2017 crime stats. We did release these, as you're aware, to the media in February. I'll have just a couple opening remarks, and then I've got a few slides, I believe. And then I'll open it up to your questions. But first of all, I want to say that largely what you're going to hear from me today will mirror what we just heard from the Attorney General statewide. And it is nice to see that there's some consistency in some of the things we're seeing across our state and within our own city. So I'll begin. The 2017 crime statistics for the city of Sioux Falls continue to reflect what we know to be true. The addiction to and trafficking of illicit drugs, specifically methamphetamine, opiates, and marijuana, are a pervasive and growing problem in our city and continue to drive the majority of the crimes reported to us, both of a violent and of a property nature. We once again set records in 2017 in the numbers of narcotics cases at 2,992 investigated by the Sioux Falls Area Drug Task Force, and this was an increase of 220 over 2016. And also arrests we made for possession of methamphetamine at 1,360. This in itself was 323 arrests greater for possession of meth than in 2016. Other increases in the numbers over 2016 were in our homicide numbers, which reached 10. That was the first time we'd reached 10 in our history. And also in simple assaults, which increased by 78 over 2016 for a total of 697. The release of the report that I'm going to share with you today on February 9th of this year coincided with the announcement of a new population number for our city of 183,200 people, an increase of about 4,700 people from 2016. And this estimate brings the number of new residents to our city over the past 2 years of nearly 10,000 persons. This is reflected clearly in our record police calls for service in 2017 of 105,865 and nearly 17,000 for animal control. What I did not expect to see was that all other categories of Part 1 crimes reported to our department actually decreased last year. This decrease, coupled with the concurrent increase in population, result in our Part 1 property crimes and violent crimes per 1,000 of our population to push lower. So how do we account for the drop in the numbers of the crimes reported to our department? While it is difficult to definitively assign a reason, I know that a big part of it is the continued dedication, visible presence, proactive policing, and community engagement being done by the members of our department, both civilian and sworn, every day. Crime prevention and suppression is not an exact science. It comes together from many directions and many efforts. We hope to see in 2018, as we continue to add numbers to our patrol staff, employ initiatives such as Safe Streets, and employ targeted drug interdiction efforts in our city with our law enforcement partners, that these numbers continue to remain stable or, in fact, even continue lower. While the trend since 2011 has been a marked increase in the amount of drug crime and the violent crime that comes along with that in our city, what the FBI numbers tell us from 2016 is that we are at the national average as far as 2016. But no, I am not satisfied with being at the national average with any crime numbers for our city. I do believe that City of Sioux Falls to be exceptional in many ways and is still a city where people from all over our region and our country want to move. It is and will remain a safe place to live and work and raise our families. The goal of an ever-increasing reality and perception of safety in our city is no accident. It happens because of the trust and communication between our citizens and our department. And it happens because of the hard work and effort of every person in our department and in our partner agencies every day. The public safety is everyone's business, and it certainly takes it all. What I'll show you now is the actual statistics from 2017, and you can see the rates compared there going back to 2013. And it shows very clearly that 13 of our 15 Part 1 property and violent crime categories did see a pullback in those numbers. This is not to say that we don't have great challenges, as I've noted, with our drug crimes, with the violent crime that comes from that. I can tell you that over the past 5 years, I think that our violent crime numbers have nearly doubled. The felony arrests have nearly doubled, and that is largely due to the methamphetamine arrests that we're seeing. Not every methamphetamine arrest is considered a violent crime, but as you can see, those have peaked there in 2016. I think it's important to tell the citizens that we did pull back in these numbers and be transparent with these numbers in 2017, and it is 1 year. I know that numbers go up and numbers go down, but I will take a minute to say that I am pleased with the direction that we saw in 2017, and as offered by the Attorney General, it does mirror what we saw across the state. So with that, if there's any questions at all, I have some additional slides that have additional numbers as well if you'd like to see them.
Any questions from the councilors? Go ahead, Councilor Staley.
First of all, Chief Burns, let me say that I believe my colleagues are very committed to affirming your team, funding your team, and letting them know that they are so appreciated because we need them. And what I'm hearing from people is that they'd like to see even more of a neighborhood presence of a police officer around. Not that I know that we had some kind of a program in the past where they were given beats, so to speak, like the old traditional things. But continuing to put that energy into those things, I think, is fabulous. I had a question about, if we're talking about larceny, that looks like it's that. What exactly does that entail?
Larceny is just the $10 word for theft. So that's your shopliftings, that's your theft of mislaid property, that's your basically the stealing of depriving another's property with the intent to deprive them of that property.
Okay, and so, all right, well, that's really all I have right now. Thank you so much.
Thank you, Councilor.
Any other questions from councilors? Go ahead, Selberg.
Thank you. Thanks for being here today, Chief. So if I'm reading this correctly, we've got 16 categories of crime. that I'm looking at, and in 13 of those, the numbers are down from the year before? Is that
From 2016. You'll note as you see the 2016 numbers there that it was up just about across the board. There were a few categories that went down. I believe burglaries went down just a little bit, and there may have been a couple others. But and our call volume, our calls for service went up by over 7% in 2016 from 2015. And candidly, counselors, that would have been very difficult if that rate would have maintained. It did give us some pause across the board when we saw those rates come in. And so, frankly, we're pleased for a variety of reasons that we saw something of a pullback. Now, we still increased to a record call volume in 17, but the rate of that increase was less, and that was welcome.
Okay, yeah, well, just looking at that, that looked encouraging anyway. And then another definition question real quickly. So simple assault, domestic, what is that? What's the difference?
Well, there's a domestic relationship defined under law, and without getting in the weeds, if you've been in a marriage relationship or a relationship where there's a child born, that also refers to family members. So any kind of domestic relationship is basically either a marriage or a familial relationship. When you assault somebody in that kind of relationship, it's categorized differently under the law as a domestic situation, and the same with aggravated assault.
Okay, all right, thank you.
Counselor Staley.
And one more, I'm looking over here at your traffic statistics. This is really quite interesting. But and we've got the driving while revoked, driving while suspended, no driver's license. And across the board, I am hearing from our citizens, no proof of insurance, that I think moving forward, and I'd say this to the mayoral candidates, that I think we can do even more with campaigns to help people drive better, more courteous driving, using your blinkers, being safe, and then, tightening, that's a state thing, but I think tightening it up, if you don't have a driver's license, you get your car taken away. We're allowing people to drive without maybe any education and insurance, and that, I think that just adds to the whole safety factor. So Sioux Falls, I do hear across the board, people are very concerned with how people are driving in Sioux Falls. So however that looks, energy from us down the road or from you working together, it's not a violent crime, but it can end up being a violent traffic accident.
Well, I thank you for those observations, Counselor. I will tell you that persons who drive without a license, drive without insurance, are just making every situation where they're out there more dangerous and actually more costly for those persons that they may get in an accident with. And so, as you can see, we take that very seriously. We hold persons to account for that. That's our mandate, among many others. But we are very concerned about that, and will continue to be.
And I'll echo, I know that you do your department does several different educational pieces. The council supported one a couple years ago where we did a texting while driving and distracted driving campaign, and we partnered together as the council and the police department and saw some success with that, with educating. And I know you do it with the schools and other areas as well. Are there other pieces that you want to just maybe mention as far as educational components that your department does?
Sure. We know, and we talk about this in the schools through our SROs too, but we know that texting while driving continues to be a very risky behavior. It leads to accidents. It leads to vehicular accidents, but more tragically, it can lead to vehicle versus pedestrian accidents anytime you are distracted inside that vehicle for whatever the reason. So we have employed over the past couple years saturation patrols where we will specifically take our traffic team and have a spotter and then have an enforcement, a person to stop that vehicle, where we can maintain a vantage point, see if persons are texting, and then stop them, and if appropriate, enforce that law. Sometimes you can, it's not exactly what it looks like, and that's the reality of a traffic stop. But we are taking measures like that and trying to reduce the numbers and educate folks on the dangers of distracted driving and texted while driving.
Thank you. And I just, one of the statistics that I see on here, and maybe if you can just touch on it, I know that recently your department did an educational piece on human trafficking and just being aware in the community. And so I'm wondering if you can just touch a little bit on what you're seeing in the community as far as human trafficking, things you do to prohibit it, what you do for stings, things of that nature.
Right. We have a unit of our department called the Street Crimes Unit, and that's one of the things that we kind of put on their plate is they will regularly look at online ads that are maybe in the Sioux Falls area. And follow those up and maybe make some contact and see if there's some enforcement they can pursue through that ad. We've done stings, we've done prostitution stings, we've partnered with the federal government and the federal authorities in some stings right here in Sioux Falls. So there's a variety of efforts that we've employed on our department to bring attention to this issue. We know that it is an issue in Sioux Falls and frankly throughout South Dakota, and we feel like that we've got a strong effort and reasonable effort to go after those folks.
Thank you. Any other questions from the committee? I know there's additional counselors here. I'll open it up to you if you'd like to make any statements, ask questions. We have invited Sheriff Milstead here as well. So if there's any questions from maybe what he's seeing from the county side, please feel free to ask those. Counselor Neitzer, go ahead.
The question I would have for the chief is, as I was looking at it this weekend, as I look at all of the weights that have been seized over the several years, they're all over the map. Is that basically driven by one-off large busts? Because there doesn't seem to be any real trend that you can glean from that. So I'm just curious about that basically across the board.
Thank you, Counselor. That is the nature of drug investigations and seizures, is you can't necessarily discern a problem as being greater or worse because of the amount that you seize. We know that it's greater and worse because of the people that we arrest in possession of those items. Depending on, when you're doing a drug investigation, depending on where you intercept the drugs in that investigation or depending on the level of the person inside the organization and when you pick them off or arrest them and what they have in their possession at the time, they may not be in the possession of the drugs at the time. They may be in possession of the cash that they've received from the sale of those drugs. So it can go up and down, it's hit and miss, and so there's not a direct, I guess, transit of property in drug seizures.
Thank you. Thank you for the question too as well, Councilor Neitzer. I'll open it up. I know that we have a nice sized group here. If there's any comments from anyone in the audience, feel free to step up to the podium and state your name if you so choose.
Sierra Broussard, Sioux Falls. So here we go. These people that on the streets of human trafficking, and I'm not going to mention no cases because they're out there, but when we see drug cartels and I'm sitting in their houses and they got their 9mm and we're seeing all of this human trafficking and this prostitution, and I'm in these prostitutes' homes, and the drug dealers saying that the cops are behind it and letting them do it, and I'm surveillancing, and all of this is coming out, and we got businesses opening up to 3 o'clock in the morning that don't supposed to, and then I'm monitoring Craigslist with these prostitutes, and I have sent them to council members, and these prostitutes are not getting busted here, so let's talk about this issue here. So what is going on with our city? 2 or 3 days ago, it was on the news media that we was number 2 with the high crime in the 25 cities. So let's put politics aside and campaigning aside, because I'm on the streets 5 days a week, okay? So I know what's going on and the corruption with the police departments. And I'm going to bring that up next week. But I'm in these drug houses. I'm sitting here with these human traffickers and these pimps. You cannot tell me that they're continuing and continuing and continuing. Oh, 8 months down the road, we're still investigating it. Oh, really? 9 months later? Nothing's happening. They're on the street corner selling the crack. Can't get it off your streets? Now, I'm from Louisiana. Monroe, Louisiana was number 1. The reason why Louisiana is like it is here is because the police participates in it or lets it go. I'm from corruption. We have corruption here. So let's clean up the police department. Then you worry about your streets and cleaning up your streets here. I'm hearing from prostitutes. I'm hearing from the transgender community on undercover cops participating in the sex crime. I will be bringing this to public input next Tuesday because I got 2 names. But I'm very disturbed with the sex trafficking that's happening here in Sioux Falls. There was an undercover police officer set up in a motel room a couple weeks ago. Did you see her at a high-end Motel room? No. Where was she? At a low-end motel room. Busting, trying to bust the Johns. Well, you know what? The rich people also are Johnning. But no, she was after the middle class to the poor sections of town on the central side. She's in her 30s. I was there at the motel when she was setting up. So why can't we go to the southeast side and southwest side of town and bust them? This is ridiculous. I think this is a showboat here. This is just a political move. So I say the next mayor gets out the chief of police, takes the corruption out, then worries about cleaning up the streets here. I'm going to tell you something here. When we have people, gang members trying to take over the Central Side District here, and we have 2 officers patrolling the Central Side when it's a high crime area, we got an issue. The county jail is full of people, of prisoners, yes, of course. And do I believe it's mostly Sioux Falls? Of course it is. Of course it is. Do we need a bigger jail for them? Who knows? But I know that they're only picking on certain individuals. And I wish I could open up my mouth more on investigations, but I can't, and give names. But I'm seeing it on the street, let me tell you. Now, these drug cartels that we need to get out of here, why do they keep selling the dope like it's trick-or-treating for Halloween? 3, 4, 5 o'clock in the afternoon. It's going like a Ronald McDonald drive-thru. Tell me I'm lying about it. The only way that I'm not going to give out the information is because I don't want to be charged with something. But they know what I'm talking about. The Street Crimes Unit is a joke on online sex trafficking. It's a joke. I see it. I monitor it. I see what's going on. None of these prostitutes are getting busted like they should. And if it is, it's the poor people, sure not the rich. This is what we have a problem with. So the next mayor that's going to go in Sioux Falls needs to clean up the city government. Let me tell you something, in Louisiana, they arrest the policeman and they put him to jail for corruption. Yes, we have a pill-popping addiction here, but we also have doctors that are abusing it and prescribing it to them like it's candy. So why is the doctors not getting busted for this? Why are we not stopping the doctors from over-prescribing to these addicts here? That's all I got to say.
Thank you, Sierra. You were just right under 5 minutes. Thank you for your testimony. Is there anyone else that would like to speak? We certainly don't encourage folks to take the law in their own hands. That's not what we are here to do. And so we would ask that you report those through the local law enforcement if you so choose to do that. We certainly don't want anyone to be putting their lives on the line for that. Anyone else would like to say anything or questions from the council? With that said, I thank you for being here. Oh, I'm sorry, Councilor Staley.
And let me just, Sierra actually took Councilor Starr and I out to do a little survey of some apartments at one time. I say she's very passionate. Thank you for caring. And Chief Burns, we didn't mention the Neighborhood Watch program, but I think we do need to be eyes and ears to help the police department too. We need to be aware of what's going on, and you guys can't do it all alone. So, absolutely. Yes, we do need to report things, and we don't want to put ourselves in danger, but I think being aware of what's going on and we'll continue to be responsive and cognizant of addressing those problems.
Certainly. I appreciate you mentioning that, Counselor. We can't do it all on our own. We have finite resources. We have finite patrol persons on the street at any given time. We are up to our authorized strength numbers and approaching that and have some more authorized. Thank you for that support for 2018. But we do depend on the eyes and ears of the citizens every hour of every day in our city, and that is a vital relationship. We simply can't do it alone. I encourage, it sounds like there's some observations of some crime going on the part of some, and please report that to us. For one thing's for sure is we can't investigate a matter or try to hold folks to accountability if that's not reported to us. So that's a vital link, and if that's not in place or if that's severed, then there's little that we can do in the immediacy of that observation.
Thank you. Thank you. Seeing no other questions, thank you all for your presentation today, and thank you for being with us. We will adjourn the
I wanted to have the sheriff come up.
Oh,
I
sure.
wasn't
Sorry,
sure
we
were
offered that,
asking.
and I
Yes,
didn't hear you say
I
that.
would
I'm
like
sorry.
to have the
Sheriff
sheriff.
Milstead, please step up and state your name for the record. Thank you.
Good afternoon, Mike Milstead, Minnehaha County Sheriff.
Yeah, thank you, Sheriff. I think it's very important that we have the county here to speak as well, because it's we've got the state, we've got the city, and then we've got the county. And Sheriff, first of all, we can't say this enough. I want you to state for the public and for us who is funding the jail and the public defender's office. I mean, once the city of Sioux Falls puts them at your doorstep, who funds that?
The county. It's usually the three magical words: you're under arrest, and from that point forward, it's the county's expense. We provide the jail, we provide the public defender to defend them, we provide the state's attorney to prosecute the case, and so we basically take that responsibility on, and that's what funds the county primarily is property tax.
And if a person is, help us to understand where the county comes into handling like a day-to-day situation that a citizen might have, a crime, is we've got the city. When would the sheriff's office get involved?
Well, we house, we're co-located in the law enforcement center. And so you'll see deputy sheriff cars traveling throughout the city of Sioux Falls, even though we're not usually actively patrolling. We back them up on calls, but primarily what those deputies are doing is serving warrants. We serve about close to 20,000 warrants in a year. Many of those people are in Sioux Falls, so we have to stop by and attempt contact. Those deputy sheriffs are also serving protection orders. When someone has an abusive spouse or someone that they need a protection order served on, that's the duty of the deputy sheriff. So again, sometimes they'll say, well, why did I see those, 3 deputy cars? It's often protection orders, it's often warrants, and then the other thing that we do is we do things like evictions and lockouts, judgments and executions, civil process, of which we do about 18,000 in a year. So those are all responsibilities that fall on the office of sheriff, and as such, I have a civil division, a warrants division, and so they have other functions they have to be doing in between calls.
So when we call 911, would we ever have the sheriff come within the city of Sioux Falls?
Yes. I mean, common with if I have 3 deputies that are working on warrant service in Sioux Falls, and there's a medical emergency, a robbery, a major crime, our officers respond as well. Our warrant task force people who are working, the fugitive task force people, oftentimes will respond to assist the city. When there's a major crime in Sioux Falls, our detective bureau and theirs are linked, and so they oftentimes ask us for help. On the other side, if we had a homicide or several homicides in the county, we pick up the phone and Sioux Falls police detectives come up and help us. So we work a lot together, and so the answer is yes, we do respond in the city, but we're just not out working traffic and driving a neighborhood. And if we're driving a neighborhood, we're looking for somebody that's wanted, or we're looking to serve a civil paper, most likely.
And then would you, you guys are out, and of course you're covering a larger territory with the whole county, but would you tell us some of your concerns about the city of Sioux Falls and what you're seeing happening?
Well, my concerns are with the city of Sioux Falls and the county as a whole, and what we're seeing in the trend. I think the trend is, and I look through about a 5-year trend, is what I like to try to gauge on what, how are we doing. And Chief Burns even pointed out, look, if we look back 5 years, where there's some areas we're growing that we don't want to be growing in. We don't want to be at the national average. And so I think some of the primary concerns, both Attorney General Jackley and Chief Burns brought up, It's the meth, it's the opioids coming into our community. One of the things that people don't talk about very often is the impact on overdoses and how many overdoses we're starting to experience. We lost 21 Minnehaha County, or 21 people to overdose deaths just last year in Minnehaha County. About a third of those were heroin. About a third of them were methamphetamine. And then the rest are various other drugs, everything from dust off to other opioids. But for the family of those 21 people, this is hitting home, and our trend in overdose deaths is increasing. Our trend in overdoses is increasing. I will say we're taking some proactive steps. I met with your fire chief, your police chief, and public health, and we're going to actually be utilizing a real-time tracker of overdose deaths and overdose calls so that we can start looking at how many are we having this week, because it's not getting to be a monthly thing, it's getting to be a weekly thing and sometimes a daily thing. And so we want to be able to track, because that helps us understand better as leaders of our agencies, you know, what some of the priorities we have to do, and also what are we seeing with the overdoses, because it's a growing issue. And we just came from a meeting with some people in other jurisdictions outside this area. One city in Ohio that went, in just a matter of 5 years, went from 112 overdose deaths in their community to 542. It is an epidemic. Now, those are primarily opioids, but we're seeing opioids coming into our community. We're seeing fentanyl coming into our community, and a significant amount of methamphetamine. And I will tell you, and I've said it before, I have never been more concerned about the safety of my officers and your police officers and our state troopers than I am today, because of, in particular, our meth users and their propensity to not be afraid to carry a gun and not afraid to use it. And now the underreported, what I'll call drug rips, those are concerning. And so I think all three of us here that have been speaking are on the same page as recognizing, and I think you realize the key threat right now in our community. Probably close to half of our violent crime is drug propelled. And if we can be aggressive and try to improve our odds at that, it's going to reduce crime. I will say that the two key components that we need to, you know, not only enforcement, but the prevention one is lacking. And treatment options are lacking. I was encouraged to hear the Attorney General talk about a state treatment facility that you brought up. I've had those discussions for probably over 15 years about the need for not only a treatment facility that's affordable, which that's the key, but also one that maybe a judge could sentence someone to, that would be an in-custody, inpatient treatment program for some of these offenders, and give them an option. Either you go to jail or you can go to prison, or if you want treatment and you'll take the treatment, we'll send you there. And so I'm hopeful that will start coming together. The second thing that's encouraging is the triage center. I mean, we've worked hard at that, and I'm hoping that if the AG's got some kind of money to find for us, one of the things that we need to do is have another partner in that triage center to help route people whose you know, moms and dads whose kid, they're starting to experiment with this stuff. Because if you experiment with meth, and in particular heroin and fentanyl, heroin and fentanyl is a death sentence. Other than that, everything's pretty good.
And one more thing. Tell us, one thing we haven't talked about here today is gang presence. Does it exist? What's the status of that, gangs?
Of gang presence?
Gangs in Sioux Falls.
Yeah, we certainly have a gang presence, but it's not like other communities that I've seen. I think law enforcement has put a lot of pressure on gangs. There are gangs here. There's significant gangs in the state prison population, and those people come out onto the street. There's significant gang presence in some of our reservations. Oftentimes they'll move and live here. There's significant gangs across America, and our mobile society now brings more gang activity. But we don't have what other, the level of gang activity or violence that I think other states are seeing. And I credit the hard work of the men and women of our police department and our deputies and our troopers and being aggressive in that area.
Counselor Selberg.
Thank you. Thanks for being here, Sheriff. Just a comment on two of your comments. I agree completely in your view that prevention is lacking a bit and really needs to be focused on. We talked about it earlier with the Attorney General. I really hope whatever we're working on solutions to that, I hope we come up with some. I think we can get the problem before it starts. Obviously, that's key on this again. One of my questions, you had mentioned the overdose. We'd lost 21 folks in Minnehaha County last year, is that correct, to overdoses? And did you say we're going to add the category of overdose calls? We don't have that now? Did you say something to that effect?
No, what I said is there's out in the East Coast where they're really dealing with overdose, they wanted to go and be able to live and real-time track overdose calls so that they could look actually on a screen and see where today's overdoses are in communities where they're losing 50 to 75 people to overdose deaths in a weekend. And so they want to start looking for pockets and being able to try to address those pockets where they're having. For us, what we looked at it for is a much better way to keep your police chief, your mayor, the sheriff, and others that are decision makers advise on what's going on. What went on last week with overdoses that your fire department responded to? What went on out in the county that my deputy sheriffs, who are EMTs, responded to that was an overdose? And it's a very simple thing. All the officer has to do is when he gets to the scene of an overdose, he tags an app on his phone. He says, I'm at an overdose. Was naloxone administered? And did the patient live or die? And that's the simple entries that they do. It geolocates them so that they know where it came from. And it allows us to start tracking. And while we're early in the overdose, unfortunately, we've got more now going than we would like to see. We've got it increasing at a rate we don't want to see. I'd like to get a baseline so that we can start reporting and be able to make decisions based on what we're seeing, because we know that's how it's impacting our drug traffic. And we also know that if people are dying, we start having clusters of people dying of overdose because it's heroin laced with fentanyl, heroin laced with carfentanil. It gives us maybe a mechanism to alert the community. Look, we've got some very dangerous things. The only trouble with that is all heroin, I will guarantee you, all heroin is on the brink of deadly. And for someone to say, well, we'll only say something when we lose 2 or 3 people on a heroin overdose because maybe it's a bad batch, the reality of it is so much of it now is bad and laced with fentanyl or carfentanil. It is almost instant death to the people who take it, when the person who made that and made that mixture, they didn't go to school to be a pharmacist. They're not a rocket scientist. And with carfentanil, you can be off by the size of a grain of salt and kill somebody. Well, I guarantee you these people are not in their right mind when they're dealing this anyway. And so I applaud the Attorney General's efforts to increase the penalties for those that are dealing these drugs. And I know that we're meeting with the U.S. Attorney next week to try to take some of these cases to a federal court, in particular where these people are dying as a result of drugs that were dealt to them. So I think we have to really start holding those people accountable.
Yeah, I think that tracking idea is terrific. I don't even know if you'd have a guesstimate, but when I hear the number 21, I wonder how many calls there were for overdoses of people that...
Right, and we never get called to an overdose at the hospital. That, someone brings their loved one in that's overdosing on, heroin or something. The hospital isn't required to call us, but we're going to work with our hospitals to see if maybe they'll give us a weekly report, monthly report, so we can kind of get a better feel for how many actual overdoses they are. We'll be able to know when the fire department goes and the police department goes because they'll have the app. But we would like to get a better picture and involve our partners in the hospitals to say, let us know. I don't care the patient name. I'm not trying to arrest them. Quite frankly, I'll tell you that I think law enforcement recognizes the need for these people to get treatment, the addicts, but we need we need to hold them accountable as well, especially when these addicts are on probation, they're on parole, they're multiple offenders, they have a violent history. You know, they need a consequence for what they do, and oftentimes that does not happen.
Right. Thank you.
Thank you.
Madam Chair, if I can just quick.
Sure, Councilor Stark.
I'm not sure, Sheriff, if you're the best to answer this, but we've talked a little bit, and it's just kind of come up in passing about the triage center or a potential triage center and where we're at. But can you just explain a little bit about what a triage center would do and how it would work, both prevention, services, or do you want to pass the ball off?
I would be able to, but we're fortunate enough to have Carrie Benz, our Human Services Director from the county here, and she's the champion of the triage center. Could I have her come up?
Absolutely. I was going to pass that off, but I wanted to at least give you a chance first.
And thank you again for being here. I'm glad it worked out for your schedule.
Thank you.
Thank you, Carrie. I'm surprised you're on the hot mic, so if you can answer his questions. I know that there has been a lot of meetings over the last several months, and so sure, go ahead.
Carrie Benz, and I'm with Minnehaha County Human Services. Our triage center really was born out of a concept of really trying to bring our community together to better serve those people who are such high-need individuals who really are intense in regards to needing high-level service. So a triage center really is a place that is for those individuals who don't need the high-end service of being in the hospital, but they certainly need access to service. And so really a triage concept, even though I think when we say triage, it immediately takes us to being more of the medical concept, it really is about being able to triage someone's needs. So being able to bring someone in who maybe they have taken some type of substance, maybe it's alcohol, maybe they're suffering from having some mental health issues. We bring those individuals in, we're able to assess them appropriately and get them linked to the right type of service. So it really isn't, we don't have the medical high need level, but we certainly have that need for having those services that are more immediately available. You'll oftentimes hear that we have the need for warm handoff, and most often people are provided with a list of places that they need to go to receive a service. Whether they have mental health, whether it be substance abuse, whatever that addiction issue is, maybe it's gambling even. Most often they're given a list and a resource sheet that says you need to access these services at these places. And the challenge for these individuals is that they leave wherever they are, whether it be they're getting released from jail, whether they're getting released from a hospital, wherever they're being released from, they never quite manage to get to that destination B. And maybe it's B, C, and E that they need to actually get to, and they never quite get there. So a triage center is really able to bring all of those services together. It provides the opportunity for that individual to connect with multiple resources under one roof, and then be able to have those individuals directly take them to those treatment facilities. It might be the outpatient mental health center. It might be able to being linked to getting an assessment for drug and alcohol treatment. It might even be as simple as all of us would assume getting to a doctor's appointment. It may even be something that simple, but for them it's not simple, because most often I think many individuals who suffer with having addiction issues, along with being homeless, along with having mental health, they're individuals that it's just easier to turn the other direction, and so they need to be seen just as any of us do. They need to be helped.
Where, if you don't mind, Madam Chairman, where are we at in the process? I know there's been a lot of work. I know you've toured around the country trying to put the concept together and what would work best for our community. Give me just kind of a rough idea of where we're at or what the next steps are as your working group continues to meet.
Sure. It's an incredible opportunity to bring together multiple individuals within our community. We've been meeting now for over a year. Initially, our group started meeting. This is actually year 6 for us, and so we've done an enormous amount of exploring in regards to numbers, trying to pull together facts. We now have been able to bring together all of that information from the hospitals, a number of vendors within the community that provide mental health services, drug and alcohol treatment, And we've been able to put those numbers together to show us exactly where we believe we need to go for our community. We have traveled around the United States and have looked at 4 different facilities, each offering different concepts and ideas and approach. We've put together a draft proposal for our policy committee. And in that draft proposal, which it will soon to be released, we actually meet as a policy committee on the 23rd of this month. And we'll be discussing what that proposal looks like. We have 3 different options in regards to size and the magnitude of which we feel that the policy committee would like to go. We also then need to look at funding, which is obviously the biggest key to all of that, and who's going to fund it, how are we going to find those resources to do that and be a provider in the community. I really believe that the triage center concept is one of which that can be a real beacon for our community. The group that's been meeting is incredibly dynamic. They're a group of incredible people who have really been committed to this process. So although I'm the mouthpiece, and I think it's just by default simply just because I like to talk a lot, I think that a lot of those individuals are very committed to those in our community to make sure that we address the needs of the people appropriately, most efficiently, and effectively. So probably the biggest step will be in locating a location in regards to where we could put that treatment facility.
Thank you.
Thank you.
Thank you, thank you. And I did receive a note, we need to be done in about 3 minutes to be able to prepare for our next meeting. This went a little longer than I thought, so Councillor Staley, you may ask a question.
Would that triage have any housing with it? Or
We do not plan to have any type of housing unit. The triage center is really meant to be a conduit to what already is established in the community. Our community is incredibly blessed with a number of entities that provide an incredible amount of service. Oftentimes, it's just that individuals don't make it to where they need to go to get the service. And so certainly in that component of that will be to have case management so that those individuals do get linked to housing along with service.
I'd love to have you come back in and do an informational for us sometime, because I really haven't heard a whole lot about this. So thank you for that, for being here.
We've done a joint city-county, our breakfast club. I know Carrie has presented as well as other times, but I think it would probably be appropriate soon to have you come back and present again, or even at one of those breakfast clubs, so we can continue to have the county present, the schools, and the city there. And it is a public meeting, open to all. So thank you so much. Great conversation today. I appreciate all the feedback and you all being here. Thank you to the Public Services Committee. I have 1 minute for open discussion. Anyone have anything for open discussion? If not,
I do. I would just say thank you. It was a great discussion.
Thank you. Thank you, Counselor. Nothing else? All right. Public Services is adjourned. Thank you.